Hi everyone, and welcome back to my Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist, and today our topic is about polycystic ovarian syndrome. Okay, before I start this topic, I just want to say hi to everyone, and I want to just inform that I will take a temporary break from this live video over the next 2 weeks. Partly is because I won't be in Malaysia for the next 2 weeks. I will be bringing my son for him to further his study. But don't worry, when I come back to Malaysia, I will definitely continue, especially during my quarantine. I'll be too free, and definitely I will have some nice topics laid out. Today's topic is polycystic ovarian syndrome. Most of us call it in short PCOS. But I noticed that many women actually call it PCOS. So I guess among the public, a lot of people calls it PCOS. But among doctors, we call it PCOS. So it's short for polycystic ovarian syndrome. So let's talk more about what is PCOS, polycystic ovarian syndrome. A lot of people have a lot of misconception. When they hear polycystic ovarian syndrome, they actually think that they're looking for cysts in the ovary, but actually their ovaries have no cysts. Funny, right? Why would you call polycystic ovarian syndrome but actually the ovaries have no cysts? And there are some of you who, even when you buy your insurance and then you inform your insurance agent that you have polycystic ovarian syndrome, and next I will get a questionnaire from your insurance asking me about your ovarian cysts, but actually you have no cysts. Why then we call it polycystic ovarian syndrome? So there's some confusion there. Why is that so? Actually, what happens in polycystic ovarian syndrome is they have polycystic ovaries. So what is polycystic ovaries? Confusing, right? Polycystic ovary and yet got no ovarian cysts. What happens in polycystic ovarian syndrome is you have these tiny little cysts that actually they are not real cysts. So what happened with polycystic ovarian syndrome, women with polycystic ovarian syndrome, what happened is that they do not ovulate every month. So we have these tiny eggs that we have in our ovaries that you're supposed to release every month. But when you don't release, then you start to keep it in your ovaries. That at the end, it looks like there's so many little cysts. It looks like you have so many little cysts, but actually you have no cysts. Those are all just your eggs. So you see, you can't really tell the difference between cysts and eggs on the ultrasound scan. They all look the same. They're all round and black. So when you see something that is round and black, we always think it's cysts. But in actual fact, in people with polycystic ovarian syndrome, they are not really cysts. They are just your egg follicles. They are your egg follicles that accumulated so many in your ovaries. So that's why we cannot call it a cyst, because theoretically when you talk about cyst, it is usually a tumor or a growth or something abnormal, you see. But it's not polycystic ovarian syndrome. Polycystic ovaries is not abnormal in the sense that those cysts are not abnormal. They are not real cysts. They are just your egg follicles. So you have accumulated so many egg follicles in your ovary, so it looks like a polycystic ovary. So actually, polycystic ovary is an ovary that looks like it has a lot of cysts, but actually there are no cysts. It just look like cysts, but they are not cysts. So that is the first thing. But when we want to define polycystic ovarian syndrome, again you must know there is a difference between polycystic ovaries and polycystic ovarian syndrome. Different. Confused, right? When we talk about polycystic ovary, it means when I do an ultrasound scan, I see polycystic ovary. But in polycystic ovarian syndrome, when you use the word syndrome, it means must have a collection of features. Must have a collection of features. And one of the feature is polycystic ovaries. So which means that even on an ultrasound scan, if I see polycystic ovaries, it does not mean that you have polycystic ovarian syndrome. A lot of women are very confused over this concept. The moment somebody tell them that, hey, your ovaries look like polycystic, then they thought they have polycystic ovarian syndrome. But no, in order to have the word syndrome, you must have a collection of features. So collection of features. So first feature we want to look at is polycystic ovaries. What else? In fact, the very most important criteria for polycystic ovarian syndrome is irregular menses. So women with polycystic ovarian syndrome, they have another feature that is very important when we want to say someone has polycystic ovarian syndrome is they have irregular menstruation or infrequent menstruation. So it can be irregular in the sense that the dates run, or infrequent, that means they have it like 3 months once, 4 months once, 6 months once. So that is the second criteria that you need to have for polycystic ovarian syndrome. So now you know, you need two of these criteria, not just one. So it's not just the scan. So you need that criteria as well. And there are some more other criteria. They tend to be overweight or underweight. You must be either overweight or underweight, not normal weight. Over or under. And another thing is they have features of extra hair growth. That means they tend to have certain features that looks more like a man, you know. They have a lot of hair everywhere on their legs, their hand, and some of them even have mustache. In fact, I see quite a number of polycystic. They're so stressed because they have mustache, they have to shave, you see. Okay, we have a collection of and acne is another one. A lot of pimple acne, that is another thing. But we do not. Some features it shows that you're more likely to have polycystic ovaries. Some features are small features that some people may have, may not have. It is not important. But basically, you need to have more than just one feature to say that you are polycystic ovarian syndrome. Most women, they will have irregular or infrequent menses. That means they have an abnormal menstruation. Plus, when we do an ultrasound scan, we have polycystic ovaries. Other features like we call hirsutism, which is extra hair growth, or acne, weight, whether overweight, underweight, all this is not the most important feature. Because weight, sometimes I can have polycystic ovarian syndrome, but maybe I'm always dieting or exercise very hard, so my weight is normal, but actually I have a tendency to put on weight one. Okay, so that's why weight cannot be a strict criteria. So at the end of the day, when you have this, you just need to think, does it affect you? In what way does polycystic ovarian syndrome affect you? So number one, if you have polycystic ovaries, but your period is always regular, and your weight is normal, and all the other criteria also you don't have, then you not necessarily have polycystic ovarian syndrome. Okay? Okay, so does it affect you? Okay, ultrasound, if you have polycystic ovaries only, you don't fit the criteria, the only thing I want to know is whether you have monthly ovulation. If you have monthly ovulation, even though the ultrasound look polycystic, it's okay. No big deal. It's normal. Chill. No need to worry. Don't go around telling people you have polycystic ovaries, okay? Because you actually do not have polycystic ovarian syndrome. So you are well, you're fine. Okay, but let's go and see about women with polycystic ovarian syndrome. Usually there's only 3 things they need to worry. 3 things. Number one is because they have no ovulation or infrequent ovulation, of course we worry they may not be able to get pregnant. No ovulation, how to get pregnant? right? So I think my previous video, I addressed this matter. If you want to know more about this, actually you can go and look for my other videos in my YouTube channel. Yeah, you go to my YouTube channel, Dr. Tan City Clinic. All right. When you have number one, we want to know whether you can get pregnant or not, whether you're ovulating or not. Because if you're not ovulating, then you can't get pregnant, right? So women who think they have polycystic ovarian syndrome, they should actually consult gynae before even they plan to get pregnant. Before you plan to get pregnant, you want the gynae to let you know whether you ovulate every month or not. Because if you're not ovulating, don't sit down and try to get pregnant 1 month, 2 months, 1 year, 2 years, 3 years, and still no baby and don't know what to do. After 3 years only go and see doctor. When they come and see me at 3 years, you know what I tell them? You have wasted all 3 years. Why? Because you're not ovulating. You never ovulate on your own. You've been trying to get pregnant for 3 years. It's a waste of time and effort and everything else. No need. Don't need to wait one. You can start treatment immediately. You don't need to wait and try on your own. Alright? So first thing is fertility. Like for me, I have to confess, I have polycystic ovarian syndrome. Why? Number one, my periods have always been irregular. Number two, when you do ultrasound on my ovary, I have polycystic ovaries. And number three, I have all my life been overweight. Okay, all my life overweight and always trying to lose weight. So you see, I have a lot of criteria. So when I got married, the first 6 months, I didn't want to get pregnant because I was a houseman. Because houseman, if you get pregnant, I have to lengthen my housemanship. Oh no, I don't want to lengthen my housemanship. So I don't want to get pregnant the first 6 months. But the moment I want to get pregnant, I started myself on treatment straight away. I never wasted a single month trying to get pregnant without ovulation because it's just a waste of time. Okay, so that would be my first advice. And as I always mention about polycystic ovaries with fertility, polycystic ovaries is a solvable problem. Every woman with polycystic ovaries should be pregnant. It's totally solvable if you actually go through all the treatment that you need to go through. And for me, I went through everything. So that's how at the end I have 3 kids. It's totally solvable. So ovulation in an polycystic ovary women is a solvable problem, okay? Second problem you need to worry about is what? Problem number 2 is we worry about uterus cancer. We worry about uterus cancer. And polycystic ovarian syndrome, women with polycystic ovarian syndrome, they can get cancer as young as 27, 28 years old. No need to be so old one. So you see, what is our problem now is, I see a lot of women with polycystic ovarian syndrome. And you know, typically women nowadays marry late, right? They marry late, they have polycystic ovarian syndrome, and they try to get pregnant on their own for a few years. By the time they come and see us, maybe already cancer. I have many women like that. Either cancer or pre-cancer. I have a few that already cancer and a lot of pre-cancer, honestly, a lot of pre-cancer. When we see a polycystic ovarian syndrome lady who's trying to get pregnant with a pre-cancer, it is a really big problem. Because they all still want to get pregnant, but deep in our heart, we all know that that's not the right decision anymore. But they won't give up. So that's when a lot of things will happen. Okay, I'm not going to go into details, but you need to know that if you have polycystic ovarian syndrome, you have a high chance of getting uterus cancer. Why? Because during the phases where you're not getting your period, like when your period don't come, your period is delayed, your estrogen level in your body is very high. And that can stimulate uterus cancer. So typically, most of women with uterus cancer have polycystic ovarian syndrome. So that is the second problem you worry about. What is the third problem you need to worry? I told you 3 problems, right? There's a third problem you need to worry about. Because polycystic ovarian syndrome, nowadays, we all know that it's linked to diabetes. So women may get diabetes when they are 40 years old, 50 years old, but they'll have polycystic ovarian syndrome since they are a teenage. So when you're young, you have polycystic ovarian syndrome. When you're old, you have diabetes mellitus. So you need to understand that you're very prone to diabetes. So you are higher tendency of getting diabetes during pregnancy, as well as all the complications of diabetes in pregnancy, like recurrent miscarriages, abnormal baby, overweight baby, higher chance of cesarean section, diabetes in pregnancy, all these issues with pregnancy and all these issues of diabetes in pregnancy, and also getting diabetes eventually. So heart disease, stroke, kidney problem, all will come. So when you have polycystic ovarian syndrome, you know that you are at risk, so take care of your diet. So if you have polycystic ovarian syndrome, it's very important from young, you need to maintain a healthy diet, which is low sugar diet. Very important to maintain a healthy weight. Very important to exercise regularly. This is very important, because if not, all those things will come. Okay, you tend to be overweight, obese, high sugar, high cholesterol, high blood pressure, heart disease, stroke, everything. Okay, let's go back to what's related to gynae. So two things. So when women come to me with polycystic ovarian syndrome, if I diagnose a person with polycystic ovarian syndrome, I want to know what stage of their life. Are you at a young age, you're not even married, you're not thinking about pregnancy, you're just concerned about your period? Or are you already married and now you want to think about pregnancy? Because that's typically what happens. A lot of women, they're very happy with their irregular menses all their life, they're not doing anything. But the moment they get married and want to have baby, they start to panic, because my period is not regular, can I get pregnant? Then they come to see us only when they're trying to get pregnant. Or are you at a phase where pregnancy is no longer a concern, but you start to worrying about, maybe I will get uterus cancer? So there are three different phases. When you come young, what I do is we want to correct everything. We want to correct everything so that your menses will be regular back. It is very simple one, that polycystic ovarian syndrome. You get your sugar down, get your insulin down, get your weight down, and be stress-free, and your period will be normal. So simple, right? Say simple only. Ask you to go on diet. Low sugar, don't eat sugar. Oh my God. Exercise. Oh my God. Stress-free. Almost impossible task. But anyway, I believe that if women are guided properly, this is not an impossible task. That's why in our clinic, we have a PCOS program. I have a polycystic ovarian syndrome program, whereby involve me, involve my dietitian, my physiotherapist, and also my counselor for stress management. So basically, why we need all these people? Because it's simple. When your sugar is high, your weight go up, your period become irregular. When your weight go up, your sugar will be more abnormal, your period again irregular. When you're stressed, your weight go up, your sugar abnormal, then your period is irregular. You see, all these three things are your sugar, your weight, and your stress, all these three interrelated and cause your period irregular. So when we want to help women with polycystic ovarian syndrome to lose weight, to get back their menses normal, we cannot just say go on diet. We cannot just say lose weight, because it won't work. Many of them will tell me, doctor, I don't eat also put on. True, you don't eat also you put on one, because it is all about your insulin and your metabolism. So what we do is we have a team approach. My only purpose is to monitor your sugar and your insulin level. It's very important, the insulin rather than the sugar, because many of you are not really diabetic. Your sugar may be borderline, but when you take care a bit on your diet, it will come down already, but your insulin may still be high. So very important, I need to look at your insulin level. So I have a dietitian who will give you the right advice as to what are the food that you need to eat and need to avoid. They will plan a diet plan for you. I have my physiotherapist to try and tailor-make a suitable exercise program for you, and also counselor to address all your stress that you're having. Because when people are stressed, they will eat. They will eat. So this is a team approach. And this is for young people. And the weight will come down, and when the weight come down, everything normalizes. That's why there are some women who can tell you that my period was always regular. But from a certain age onwards, they only become irregular. So they only become polycystic ovarian at a certain age onwards. Partly is because before that, their weight may be normal, their diet may be okay, they may be stress-free. But when they reach a certain age onwards, maybe that's when their stress comes up. Maybe because of a job or something related to their lifestyle, certain inconveniences to eat healthy food, stress go up, weight go up, then they become polycystic ovarian syndrome. Even a lot of women in the past, especially women in the past, I always like to say, no, those days you all see all those women when I was like 20 years ago when I work, you see a lot of women before they are married. All these women from the kampung, they all thin, and their period is regular one. But then they pregnant, then they put on so much, and then after give birth, their period become irregular. So they get polycystic ovarian syndrome only after they give birth. So remember that polycystic ovarian syndrome is very much linked to your sugar, your weight, and your stress. These three takes time. It takes time, it takes motivation. So that's what we do. That's the first group of women. Second group of women are people who are like, want to get pregnant and then find gynae and then tell gynae, I want to get pregnant. Cannot get pregnant. Already tried 1-2 years. Or I just married. I want to get pregnant. These people, if I try to ask them to go, come let's lose weight, go on diet. I've tried everything. I have polycystic ovarian syndrome. I know I'm not ovulating. When I was in university, I already visited my lecturer and I already know that I'm not ovulating. So the moment I wanted to get pregnant, I tried everything because this doesn't work, that doesn't work, then they keep upgrading. That's why I say it's upgrading. I mentioned earlier that ovulation for polycystic ovarian syndrome is a solvable problem. Everyone should be able to ovulate eventually. We try from the simplest to the most complicated. Usually these women have no time to wait. If they are younger, maybe. Some of them, they come to me, they are married, they want to get pregnant, but they're only like 24, 25 years old. Maybe we can still work on weight loss, diet changes, stress management, and hopefully they ovulate on their own. But typically, most women who come and see us are in their 30s, so we also do not want to waste too much of their time. And we know that fertility goes down with age, and we do not want to waste too much of their time. We have to get them pregnant as fast as possible. Then another group of women with polycystic ovarian syndrome, all they want is to prevent cancer. They're not thinking about getting pregnant. Either they already had kids, or they are not married, but they only worry about cancer. And then to prevent cancer, depending on their age again, young girls, yes, polycystic ovarian program to help them lose weight, yes, it works. But sometimes when they are like in their 40s, late 30s, it can be a bit difficult to get them to lose weight already. So most of the time, we just use some simple method just to prevent cancer. Uterus cancer is the easiest cancer to prevent because we all know that uterus cancer is due to high levels of estrogen. So what can counteract estrogen? What can suppress estrogen? As I mentioned in my uterus cancer video, all we need is progesterone. So we give them some form of progesterone. It can be oral tablet, it can be an implant, it can be something that we put in the uterus, it can be any form of progesterone that would be able to suppress the estrogen and prevent the cancer. So there are many methods of preventing uterus cancer. In fact, it's so easy to prevent uterus cancer. So most of the time, I will just guide them, advise them, educate them on the importance of preventing uterus cancer because their chances of getting uterus cancer is very high. So just go on something until you menopause and that's it. Problem solved. Upon menopause, if you have no endometrial hyperplasia and no endometrial polyp, you don't need to worry, you won't get uterus cancer anymore. That is usually the case. Okay. Unless, there are some small group, I wouldn't say no completely, a small group because their sugars are very high. So because of their sugar being high, they can still get uterus cancer at a later age, but they're very rare. Most uterus cancer happen when they're young. 40s, 50s is the normal age for uterus cancer. Not 70, 80, a bit rare. Okay, so those are the things I have to say about polycystic ovarian syndrome. Actually, I have many other videos on polycystic ovarian syndrome earlier on in my YouTube channel. You can go there and visit all those videos. They address different issues. So today, because the last round I noticed that there's so many questions, they were asking so many questions, so I decided to have one video just on polycystic ovarian syndrome. So when it comes, this is gynae related that I've mentioned. Of course, obstetric, there are a lot of other issues as well, which I mentioned earlier, recurrent miscarriages. That's why it was in the miscarriage video that we talked about it. So recurrent miscarriages, and also all the issues with diabetes in pregnancy, and also diabetes in general. Okay? Dila asks, is polyps normal due to PCOS? Polyps can be due to many reasons, but PCOS women have a very high chance of having polyps. And if you have PCOS and you have polyps, we are very worried, because polyps is where cancer start from, okay? Uterus cancer, they do not develop out of nowhere. They start from polyp. Not all polyp will become cancer. So when you have a polyp, initially it will be a benign polyp. Then only it will be a polyp with endometrial hyperplasia. Then only it will become cancer. So it goes step by step. Cancer don't come overnight. I always tell a lot of women, cancer don't come overnight. So if you are always very diligent, checking, when we look at cancer prevention, that's how we start. We always start with we always look for polyps. When you have polyps, if you get rid of the polyp, then you got no cancer. Okay, so it's actually step by step. So yes, polycystic ovarian syndrome women tend to have polyps, and the polyps can be potentially cancerous. And polycystic ovarian syndrome, if you have polyp, the polyp can also stop you from getting pregnant. In fact, I have quite a number of women that with polycystic ovarian syndrome, even after all the treatment we give them and they're ovulating, they still can't get pregnant. You just need to get that polyp out of the way. You just need to get it out, and polyp is so easy to get it out. You just need to suck it out, and then it's out, and then only they conceive. And many of them, they conceive like the next month, after I take out the polyp, they're pregnant the next month. It's like so simple. Lily asks, I have polycystic with hyperthyroid. Is there increased risk of uterus cancer? It's the same. As long as you're polycystic, you have increased risk of uterus cancer. Nothing to do with thyroid, because thyroid hormone doesn't actually affect uterus cancer, but polycystic ovarian syndrome have increased risk of uterus cancer. Okay, so must know how to take care. I have a lot of video clips on how to prevent uterus cancer. You can always go to my YouTube channel and look at it. Okay. Sato asks, food that contain collagen, would it affect growth of PCOS or cysts or endometriosis? Okay, I always say if it's pure collagen, I am not too worried. But if you're talking about food that contains collagen, I'm not worried at all. If you're talking about supplements that contain collagen, that I'm worried. Okay, so because supplement is not same as food, yeah. A lot of you think that you're eating supplement to replace food. Supplement is not the same as food. If you want a lot of collagen, please eat collagen as a food source, and not eat collagen tablet, yeah, or eat collagen supplements in other forms. Some of you are sachets and things like that. No. Jolene asks, would you recommend Ovacitol? The right word for it is inositol, not Ovacitol. Ovacitol is probably the brand name, or the fancy name we call it. Okay, so the actual drug name is called inositol. Yes, I recommend inositol. It actually does work. I usually recommend inositol in the first group, not in the last group or the center group. Why? Because inositol takes time to work. So I don't usually give inositol in the ovulation group, but I guess there's no harm. But I usually do recommend it in the first group where you're trying to correct everything. But you need to understand, polycystic ovarian syndrome is here to stay. It is lifelong. Because it's diabetes, it's lifelong. If you want to take a supplement called inositol, you also need to take it long term. Okay? The only problem with inositol is quite costly. It's not that cheap. So that's why not really a mainstay if other things are already working. Okay? Shobana asks, hi Dr. Tan, is hysterectomy also one of the options for polycystic ovarian patients once they are done having kids? No, I think it's a bit overtreat, removing your uterus because you have polycystic, because you worry you're going to get uterus cancer. Oh, no. So no. Because it's so easy to prevent. So it can be prevented. All you need to do is just something simple and prevent your uterus from becoming cancer. No need to remove the uterus, okay? No need to remove your uterus unless really necessary. Can you give example inositol that's good and affordable to buy? So much brand out there. Yeah, it's just so much brand because it's a supplement. So there is no such thing as good brand, bad brand. There's just so much brand, but it's usually very costly. So as I said, inositol is very costly. It's not that it's not good to take. It's good to take, but it's very costly, and it doesn't actually solve your polycystic ovarian syndrome permanently. You understand? Because the problem with polycystic ovarian syndrome, it is still diabetes. So you have to think about diabetes. So inositol is something you can take. It helps, but probably you still need to take it long term. So go back to the root cause of the problem, which is high sugar level. Make sure your sugar is forever normal. So it is not just as simple as normal blood sugar, because most of you still can have normal blood sugar, but you are already polycystic ovarian. So why you have normal blood sugar is because when you're young, when you take sweet things, your body can still compensate. But it compensates by increasing the insulin level high, super high. A lot of young girls, you look at their insulin like 20, 30, 40 already. So because their insulin can still go so high, that's why their sugar level is still normal. But the root cause of polycystic ovarian syndrome is the insulin, not the sugar actually. So generally, we still need to control our sugar. If have normal weight but have irregular period, what about methods to control PCOS? You may have irregular period, but you have normal weight, we still need to look at your insulin level, because it's most of the time still back to insulin issues. So same thing, is still diet, because not all polycystic ovarian syndrome are overweight. Generally, they tend to be overweight or underweight, but polycystic ovarian syndrome is linked to diabetes, so we still need to look for the thing. All right, that's all for now. Thank you. Bye bye.